Women's health is receiving increased attention, but science is still not filling society's needs when it comes to vaginal health. For example, in the last 40 years, no major breakthroughs have been made to manage bladder and vaginal infections. One way to set a socially relevant research agenda is to actively involve citizens in scientific dialogues. We founded ISALA as a citizen science project to significantly advance research, diagnostics, and therapeutics for the vaginal microbiome. More than 5,500 women in Belgium signed up in the first 10 days of registration to participate in ISALA. ISALA expanded internationally with a sisterhood of over 20 countries in Europe, America, and Africa. Jointly, we break taboos on women's health, increase scientific literacy, and provide new insights into association of lifestyle with vaginal microbiome. The number of participating women is growing worldwide, increasing diversity and representation in microbiome research. Together, we are building the largest citizen science project in the world on the vaginal microbiome.
I'm Dr. Iona Benge. I led Depression Detectives alongside Sophia Collins and researchers at the University of Edinburgh. Depression Detectives brought together people with lived experience of depression and big data researchers to conduct a small research project. Using an online survey and data from UK Biobank, they found that most episodes of depression were not taken to a doctor. People only went to their GP with their most serious episodes. Instead, people used private talking therapy and things like meditation. The implication for data scientists is that electronic health records may provide a very incomplete picture of depression. I'd like to extend a huge thank you to everyone involved, particularly our lived experience participants.
At the Dignity Project, we collect data with citizen scientists with disability to embed dignity into the way we work, build things, and treat people to improve health outcomes. People with disability are the experts of their own experiences, and we partner with them to uncover their stories, perspectives, ideas, and solutions to enhance health equity and inclusion. Our unique research model and digital engagement methods are citizen-led, with key researchers playing a supporting role and providing our citizen scientists with training, opportunities, and tools they need to make their collective experiences matter. Because of our work over the last 5 years, we now better understand how people with disability navigate rehabilitation and health service systems. We know how to embed dignity into healthcare to improve engagement in rehabilitation and the community more broadly. We know the impact of engaging end users in service planning, design, delivery, and implementation to create sustainable change. We're dedicated to being informed by stories that would otherwise remain unheard, and working to illuminate future possibilities for reform and change.
I'm Mark Fahey, a Professor of Clinical Exercise Science at the University of Derby. I am currently leading several international investigations to increase understanding and awareness of long COVID, including clinical datasets and lived experience. Putting the patients at the heart of the research gave us a strong insight into the challenges that patients were facing. And while it gave us an incredible insight, it also gave us a lived experience philosophy that now underpins all of our research activity. We are interested in understanding the pathophysiology of long COVID, and we hope to progress this into treatment and intervention trials that can improve patient outcomes. These trials are developed and enriched from the inception to completion with a lived experience. And to make sure we are asking the questions that matter, we have to enable their support, and the impact this has had on our research quality and impact is unquestionable. Without being inclusive and creating a space and opportunity for the lived experience, we would not have achieved what we have achieved and are yet to achieve. I am incredibly proud to lead a high-performing and thriving research team that is and will continue to make a difference to so many around the world.
Globally, 1 in 3 women experience physical or sexual violence in their lifetime. I am one of them. Nearly 30 years ago, that violence left me with scars and an HIV-positive diagnosis. Every minute someone dies of HIV. This video is 1 minute long. But against all odds, I survived, and I wanted to make a difference in the lives of other women facing this terrible reality. Over the years, I've worked with sex workers in Argentina, indigenous women from Amazon, women surviving violence and HIV in Brazil, Uganda, Mozambique, Kenya, queer persons from Brazil, and many others. Together, we've co-created new interventions, improved health services, co-authored many scientific papers, and even influenced national laws. Every strategy we developed was built with and for local communities. We, people with lived experiences, are the true experts of our own lives. It's way past time we had a seat at the decision-making table. Nothing about us without us.
Hello, I'm Dr. Jolie Sasakamus.
And I'm Dr. Mamata Pandey. We're excited to share our maternal care program with you.
During the COVID-19 pandemic, many mothers in our Indigenous communities faced isolation, making it difficult to access support. Our maternal care program provided crucial assistance by offering traditional bundles, which included items like baby blankets, baby moccasins, traditional medicinal herbs and teas, and teachings that help strengthen cultural connections during challenging times.
These bundles brought physical items and a sense of care and connection to their traditions, helping mothers feel supported and grounded.
Our program aimed to ensure that even in isolation, mothers had the resources and community support to navigate motherhood in a culturally safe way.
We're committed to continuing this important work, empowering Indigenous mothers and families in their healthcare journeys.
Thank you for watching.
My name is Catherine Underwood, and I'm the project director for the Inclusive Early Childhood Service System project. The IDCSS project is an innovative partnership which aims to understand the systemic rather than the individual mechanisms through which disabled children gain access to health, education, and social services. Our ultimate goal is to inform social policy, programming, and broader society about the experiences of disabled children and their families. This involves introducing more complex discourse on early childhood disability that is grounded in understandings informed by disabled children and their families over a 10-year period of time. Please visit our website for more information about this innovative project.
I feel happy and proud because all the refugee learning centers participated actively in fighting the spread of COVID-19.
Refugee communities were disproportionately impacted during the COVID-19 pandemic. It exacerbated educational inequalities and negatively impacted their mental health. In response to these critical gaps, the Foster Project aimed to assess the feasibility of COVID-19 self-testing in refugee learning centers by training teachers and community health workers to implement a self-testing strategy for early detection and intervention. The project showed high acceptance of the self-testing intervention among parents and teachers. The provision of self-test kits, masks, and sanitizers were essential in overcoming implementation barriers. The project showed that community-led interventions reduce risks, improve health and school attendance, and advance health equity in underserved populations.
Everybody deserves equity of access not only to participation in research, but also to understanding the evidence generated so they can make informed choices about their health. But in a diverse, multicultural country such as Uganda, how do we achieve this? The Infectious Diseases Institute has a vision to see a healthy Africa free from the burden of infectious diseases. And at the Infectious Diseases Institute, we incorporate community engagement and involvement alongside all of our research and clinical activities. Some of these events take place within the building and others out into the community, but at all stages the priority is establishing clear, transparent dialogue based upon trust. Some of the activities include community advisory boards, They include group meetings, focus groups, and increasingly we've incorporated artistic techniques such as art, drama, dance, music, poetry, and more. And in doing so, we establish that relationship with trust, which does take time to build, but is immensely rewarding. Community voices are present at all aspects of our research, from the very start through to dissemination. And the At the Equator project aims to bring all of this together. Together, we can achieve that meaningful partnership. Together, we can achieve equity.